Hi, I'm Dr. David Justice. I'm the Chief Medical Officer here at Tandem Health. And I'm speaking to you today. We're recording this just after the Thanksgiving holiday. And we've had some requests from both employees and also from some businesses to provide some information because the vaccine mandates are starting to be rolled out and some businesses are implementing them, to give you some updated information about the vaccine and answer some various questions that some people have posed. So I hope that you find this video useful.
Good morning. If you have not been vaccinated and you had COVID, received the antibody infusion, should you wait if you still have the antibodies in your system, or should you go ahead and get the vaccine after a certain period of time?
Okay, so there's really two parts to that question. The first is if you've had COVID and recovered, but you didn't go to the doctor, you didn't get an antibody infusion or any specific kind of treatment, then the question is, should you still get the vaccine? The answer is yes, because the antibodies that you develop from just getting the coronavirus infection are less robust than the antibodies that you get from getting the vaccine. And those antibodies, the ones that you develop from getting vaccination, we think are protective against the variants that are out right now. And there's a new one that just came out called the Omicron variant. We're not sure yet what impact that will have on our vaccinations, but right now the evidence is that vaccinations are the best protection against all of the variants. And the second question is, if you've had the coronavirus and you've needed to get medical treatment to include antibody infusion, should you wait? The answer is yes. You should wait about 90 days after you've had the antibody infusion before you get vaccinated. If you've just had coronavirus and recovered and you haven't gotten any kind of treatment, the only waiting period is to wait until you're symptom-free. Once you're symptom-free, then you're eligible to get vaccinated.
If you had side effects when I received the monoclonal antibody infusion, have not yet been vaccinated, should I be concerned about the side effects from receiving the vaccine as well?
Well, you always want to talk with your medical provider, your primary provider, whoever that is, about any kind of concerns that you may have about getting any kind of medical treatment to include vaccines. However, the treatments are different. So getting a monoclonal antibody infusion is a different kind of treatment than getting vaccination. The vaccines actually have very few ingredients, especially the two mRNA vaccines. That's the Pfizer and the Moderna vaccine. Those are the most prevalent vaccines that are available in the communities. And those are the ones that both require two-step injections. You come in and get one shot, and then you come in a few weeks later and you get the second shot in the series. And those vaccines have very few ingredients. They're basically composed of fat droplets that contain sugar and salt and the mRNA instructions that tell our cells what to do to make the spike protein that then generates the antibody response.
What are your thoughts on the booster shot if you've been fully vaccinated, and if so, what is the time frame?
Okay. I think that boosters are a great idea. They are highly recommended for everyone. And boosters now are available for anyone age 18 and over. So once you've completed your series of vaccines, you have to wait a certain period of time before you really should consider getting a booster. If you had the Johnson & Johnson vaccine, that's the vaccine that uses a little different, older technology, and that's one where you only have to get one vaccination in the first series and then you're done. If you've had the Johnson & Johnson vaccine, you have to wait 2 months and then you're eligible to get a booster. If you've had either the Pfizer or the Moderna vaccine, those are the ones that are the two-step vaccines that use the mRNA technology. In that case, you should wait 6 months and then consider getting a vaccination booster.
Will we need to get ongoing COVID-19 vaccine boosters like we do for the flu?
That's a good question that we just don't know the answer to yet. The data is that right now it looks like getting vaccinated and then getting a booster shot 6 months later does give you a robust number of antibodies that we think will protect you against most, if not all, of the variants that are out right now. But in the future, we just don't know yet. We don't know if the immunity that we get from getting vaccinated and boosted, does that last all of our lives or for years, or does it tend to recede over time? So we're going to have to find that out. It may be that we have to get just a routine booster of the COVID vaccine, just like we get a flu shot every year, which may be retooled if there are new variants that come out.
How do the vaccines work in our bodies? What do they do in our bodies in the future?
Okay. So we have no evidence that the vaccines do anything in our bodies over the long haul. And let me explain kind of how the vaccines work. As I mentioned in an earlier question, there are two different types of vaccines that are available right now. There's the Johnson & Johnson vaccine. That uses the tried and true method of using a different kind of virus that's been inactivated so it can't infect you. It's called an adenovirus that causes like common cold symptoms, but it's been inactivated. They use that virus as the mechanism to introduce this spike protein into our systems. The spike protein, you've probably seen a diagram of the coronavirus, and it's shaped like a ball and it's got these little spikes all over the surface. Those spikes are the key. Those spikes are how it enters our cells and infects us with coronavirus. So if we develop antibodies against those spikes, then we are protected from getting infected with coronavirus, and especially from getting serious infections or dying from coronavirus. So there's the Johnson & Johnson vaccine that uses that technology. Then there are the Pfizer and Moderna vaccines. Those use a newer technology that's been out for a number of years, been used in a couple of other medical applications previously, and this is the first time it's been adapted to use in a vaccine preparation. And what that does is uses mRNA. That's an instruction that our cells have all the time. All of our cells use mRNA. This is the instruction. You can think of it like a blueprint that tells you the instructions for building a building. And our cells use mRNA to tell them what to do, to make proteins, to turn on and off switches in our cells, to do various other metabolic things in our cells. So the mRNA that's in the vaccines gives us the instructions to our cells to make the spike protein. Again, that's the key that we want to get exposed to so that we can develop antibodies to it. And so the mRNA goes into our cells, it gets read, our cells generate the spike protein, and then just like any other mRNA in our cells, the mRNA is destroyed. So in our example of a blueprint, imagine if you were a contractor and you gave your crew a blueprint to build a building. They built the building and then they burned up the blueprint. You like the building so much that next week you want them to build the same building in another location, and you tell them to do that. They would come to you and say, "We don't know how to do that. We burned up the blueprints. You need to give us a new set of blueprints." That's the way our cells work. So these mRNA particles that are in the vaccine, they're really tiny, and they're read and then they're destroyed. So this isn't permanently changing us in any way, except that it's exposing us to the spike protein so that we can develop antibodies. It's also important to remember that that's to be expected, that we will develop an antibody response. That means that when you get an injection of the vaccine, you'll feel a little bit tired, you'll feel achy. You may feel a little bit like you have a headache, or you may feel exhausted. You'll probably have some pain or irritation at the injection site. And that's an expected side effect of the vaccine. That's what we want it to do. We want it to develop a robust immune response so that then, if we happen to be exposed to the coronavirus in the future, our bodies are ready to fight it off.
You kind of answered the question, but the side effects of receiving the vaccine, common versus severe. I know some people are concerned about some severe side effects that you may hear on the news.
Sure, and there have been cases, just like there are cases of severe side effects with any medical treatment that you might consider, including common things that you may consider buying over the counter. If you look at adverse event rates for things like Tylenol or ibuprofen, it's not zero. So some people have had significant serious side effects up to and including death from those treatments. But they tend to be very rare compared to the people that get benefit. And it's the same case with the vaccines. Now, in the clinical trials that were used to get the authorization from the FDA, they had a number of people that got the active vaccine and a number of people that got an injection of just salt water. And in those clinical trials, the number of people who got significant adverse events, and this is any adverse event during the time frame when you got vaccination, whether it was related to the vaccine or not, the number of people that got significant problems during the time that they got vaccinated in the active group that got the active vaccine was about 6 in 1,000. The number of people that got serious problems in the saline group and the people that just got an injection of salt water was 5 in 1,000. So those are really small numbers compared to the number of people that have been treated. In this country, we've had millions of people already that have been vaccinated, and we've had a very low rate of significant side effects or serious side effects. The other thing to keep in mind is that you have to compare the rare chance that you may get a side effect from the vaccine, from the chance that you may have a problem from the coronavirus. In Sumter County here, our rate of infection with the coronavirus is 1 in 6. So 1 out of every 6 people so far has been infected already with the coronavirus. And that sometimes causes problems. Sometimes people recover. Sometimes people, even if they recover, have long-standing problems related to the coronavirus infection. Here in Sumter County today, I just looked at the numbers, your rate of dying from the coronavirus is 1 in 353 if you happen to be infected. So I would take a rare risk of getting a side effect from an injection over a much larger risk of getting serious problems or dying if I happen to get infected with coronavirus.
Where's the best source for the public to read about medical research and studies about the vaccine?
Okay. Well, there are a lot of avenues where you can get information, and some of them are reputable and have solid science behind them, and some of them are people that have kind of cherry-picked the information that they want to present to you, or may even present as fact what is really just their opinion about things or their sense of how things might go. So I would stick to the reputable sources such as the CDC. They have cdc.gov has a website that has all sorts of information about the vaccines, including the information that I just mentioned, as well as more detail about what are the actual rates of serious side effects and what were the serious side effects that people may have gotten from getting an injection if you're concerned about that. It also has rates of risk if you happen to get infected with the coronavirus. It has links to some of the studies that were done that actually got the approval from the FDA for the vaccine injections. Also, DHEC here in South Carolina has a wealth of information about both infections. It also has specific information about our local communities. So you can see kind of how our community compares to the rest of the state and also the nation in rates of infection. So those are the 2 sources that I would highly recommend as places to go if you need further information.
Should children receive the COVID-19 vaccine, and what about the boosters?
Okay. So first, with the boosters for children, it's unclear yet whether children will need boosters or not. Children's immune systems are a little bit different and they are very robust. So sometimes children's immune systems are better able to fight off infections than we are as adults. That's why you may have heard that even if children get infected with the coronavirus, their rates of having serious problems or dying is very low. Now again, it's not 0, but it is very low. However, there have been serious cases of inflammatory reactions and other problems that some children have suffered from getting coronavirus infections. So I still recommend that if your child is eligible, if they are 5 years of age or older, that you get them vaccinated. We have vaccines that are lower dose for children ages 5 to 11, that's the Pfizer vaccine. And then we also have the Pfizer vaccine available in the full adult dose for children ages 12 to 17, and then also for adults as well. So I highly recommend that you consider getting your children vaccinated, both for their sake and also because even if your child may not have a serious infection if they get exposed to coronavirus, the concern also is that your child doesn't live by themselves. So your child may get exposed to coronavirus and they may do fine, but they also bring it home. They may expose you. You may have older relatives living or staying with you temporarily. The holidays are coming up. There's going to be a lot of family gatherings. What if your child got exposed and then happened to expose an elderly grandparent or aunt or uncle or someone who's immunocompromised to the coronavirus? So for all those reasons, I highly recommend that children also get vaccinated.
Thank you, Dr. Justice, for your time.
Thank you, and I hope this has been helpful.